Assalamu alaikum. In this video, we will cover proper procedure in the event of exposure to a patient with Ebola virus. It is very important that physicians and healthcare workers protect themselves, their families, other patients, and the community. Using correct hand hygiene and personal protective equipment with additional protection is essential when caring for confirmed cases of Ebola virus. All hospitals need clear procedures and policies for monitoring and managing potential exposure of a healthcare worker. If an incident happens and a healthcare worker who is unprotected has been exposed either percutaneous or mucocutaneous exposure to blood, body fluid secretions, or excretions from a patient suspected or confirmed case of Ebola virus, should immediately stop work, wash the affected skin surface with soap and water. Immediately contact the occupational health supervisor or infection prevention and control team for assessment and access to post-exposure management services for all appropriate pathogens. Response must be quick with a calm approach. If healthcare workers develop a sudden onset of fever, intense weakness or muscle pain, vomiting, diarrhea, or any signs of hemorrhage after an unprotected exposure, they must stop work immediately or do not report to work. Notify their supervisor, seek immediate medical evaluation and testing, notify the public health infection control departments, exclude from work until all results show no longer infectious. Some healthcare workers may be asymptomatic, who have had unprotected exposure at the time of patient contact or through direct contact with blood or bodily fluids of a patient with Ebola virus disease. For asymptomatic healthcare workers, they need to receive medical evaluation and follow-up care, including fever monitoring twice daily for 21 days after the last known exposure. Hospitals should consider policies ensuring twice daily contact with exposed healthcare workers to discuss potential symptoms and document fever checks based on the hospital policy and in discussion with public health authorities. Healthcare staff may continue to work while receiving careful monitoring with twice daily fever monitoring. Asymptomatic healthcare staff are not allowed to travel by public transport, such as airplane, train, or ships. Taxi or bus transport should be risk assessed in consultation with public health teams. For healthcare staff working in the community, the same applies. Public health should contact the asymptomatic health workers daily for 21 days and advise the worker on maintaining their daily activities.